Hello, my name is Ron Fisher, and I'm going to give you a brief overview of some of the work that we have done on mental health challenges during COVID in Brazil. Here's the overview. There are three major sections. The first on the state of mental health, the second one, what people have done to improve their mental health, and the third one, what kind of services they have used and what kind of services they would like to get. Here are the surveys that I will draw on for my presentation. Three of them you probably are quite familiar with. The third one is a nationally representative survey, and I will briefly talk about it in a second. So what do we know about mental health during the pandemic? First of all, international data shows it has really increased levels of anxiety and depression, and women are typically worse affected by this and younger individuals. Now, focusing on the case of Brazil, here is some three-wave nationally representative data that we collected in collaboration with Civis. And so it captures a population at three different time points right at the beginning of the pandemic, at the start of that um, Delta wave, and then Omicron, or just before Omicron started to really hit the country. So the data was collected, the last wave was collected just after, like vaccines started to be rolled out. The interesting first finding is there are no differences across regions in the country. The second difference that we found overall is women, similar to the literature internationally, are worse affected. And the third major finding is that younger individuals report worse mental health. Very interestingly, there were no differences between social classes, also no differences across the three waves that were significant on average. The major difference was that when we started digging a bit further into the data, separating out individual difference effects, those individuals who were more worried, more stressed, more anxious at a particular time point then tended to do worse at the second or the third time point. So basically reinforcing effects. So rather than having general effects in the population, initial baselines may make a difference. So now focusing on vaccination and prior infection on mental health, what we know from the literature, once you had COVID, your mental health typically tends to go, becomes worse. And we also have seen in data from the US in particular, once people got a vaccine, their mental health increased, although those effects tend to wear off after some time. So now drawing upon the vaccination study, which is an observational study at a particular point in time, as the Delta wave was kind of coming towards an end, and like vaccination started to ramp up. People may have been very anxious to get the vaccination. The data was collected very close, either just before or after they got vaccinated. Vaccines were not available widely in that particular age group at that point, so that may have influenced how people responded to the survey. We used classic measures that have been used in these international studies as well. So we used the PHQ-4, which in our case broke into an anxiety and a depression component. We also included an optimism, a very brief optimism measure, and a subjective health measure. So what do we find? The first thing is similar to the overall pattern. Females report worse mental health. Second of all, similar to previous studies, prior COVID infection, subjective report of a COVID infection is associated with worse mental health. Really interesting. The vaccine effects are either counterintuitive, so actually those individuals who had a vaccine reported greater anxiety, or we have some very interesting vaccine by time effects. So what you can see down here, those people who are fully vaccinated, it doesn't actually matter how long ago that was, they report quite good subjective health. But those individuals who had only one dose, the further down history that was, like if it was quite some time ago, they report worse subjective mental health. So the clear take-home message, at least for this pattern, is, like if people had one dose, we should try and get them to get the second dose, or potentially like now the booster doses as quickly as possible, because that will improve their subjective health. So now moving to the second part, what did people do to take care of their mental health, which I think is an interesting point, which is often neglected. Like because we often take our researcher caps and think like, okay, so what is actually helping people? And then we ask them, did you do that? And so we actually turned this around and we ask, what did you actually do to take care of your mental health? Yeah, so taking, like like asking the individuals what they thought was actually effective for them, and that's why they did it. So the first thing we did a street interview, and then just asked them, what did you do during the pandemic to take care of your mental health? And what we found is, very interestingly, after doing some qualitative analyses, a lot of people said like, I just worked to, like feel better, which is very interesting because it's something that we don't typically see in the literature. And then, of course, we also see, like people just listen to music, watch TV shows, um, social interactions, which may not be recommendable from a COVID protection perspective, but, like meeting up with your mates and drinking can actually be quite good for your social, for your mental health overall. We also found strong effects of religion, so people, like praying or going to church. So then we followed up and we asked people in the long COVID cohort, so those people who were um, definitely infected and were being accompanied in this research program. So the first thing that is really noteworthy here is bit over half of the population actually said they didn't do anything to take care of their mental health, but a good portion of those individuals actually felt a need to do something, but they didn't know what to do. Those individuals who did something very different to the street interview that we did, a lot of them actually did physical exercise. And also, a very positive point is a lot of them had access to therapy. So they actually used therapy in order to take care of their mental health. So, what are kind of implications for health providers overall? I think what is informative is actually what is missing. So low cost, high effectiveness options like yoga, meditation, mindfulness are not widely used. So there's something that we could recommend. So making these options available to individuals, making people aware of these options is important. Also, a second thing is a good subsection of the population felt they wanted to do something but didn't know what to do. Again, there is scope for better communication. And another point that is really worth mentioning is the importance of paid work for mental health, because this is something that is not typically mentioned in the literature. And this has both if we think about it, it has both a component of like just taking your attention off issues like COVID or mental health issues, but also, like it brings income. So it reduces actually anxieties that may arise because of, for example, inability to pay bills. So now coming to the third section, what kind of services people use and how they perceive them. So let's focus first on usage of services. So we ask people within the long COVID survey, what kind of services do you actually know within the community? A large majority said like, I don't actually know what services are available to me. A few people did. But on the positive side is people did know, on like the great majority of individuals, they had an idea of where they could look for information. So family clinic was the most commonly used response, followed by the Mare network and other providers, for example, like private services, the SAS, telehealth system, etc., etc. So, people are pretty much aware of where they could find out. Then we asked them, if you want to get more information, is this, first of all, is that important for you? And the vast majority of people said, like, yeah, I want to find out more about mental health and how to take care of my mental health. And then we asked them, like, how would you actually want to, like, find out, what kind of formats would be useful for you? And the great majority of people said, like, yeah, I want to have videos, and closely followed by, please develop some apps so I can, like, find out about mental health issues. Also followed by audio, so probably audio recordings that can be shared, podcasts, etc. Low-cost alternatives like leaflets or cards were actually not that preferred in the population. So the first thing here really is videos, apps, and audios are way more costly, and that's something that we need to consider. So now, what kind of services did people use? Uh, the vast majority, even though, like, therapy was much more available in this cohort overall than in general, the vast majorities did not use any services. Those people who used services, about like 19%, most of them used in-person services. Very few people used online services. The positive thing is, very positive feedback about the services. It worked well. Majority of people reported no problems. But interestingly, most of them actually heard about these services that they used through friends and family. Now, asking about what to do in the future, what kind of services would you like to have? Should it be in person or online or whatever? The vast majority, again, preferred in person. So, really, this personal touch, personal intervention is really important. Online, only a very small group preferred online only. So now, evaluation of other resources that are available to participants, and there are resources like this leaflet, the mental health leaflet, and videos that have been produced that provide some kind of activities. So to briefly give you a feel for what it is, the leaflet, the mental health leaflet, um, for example, provides an overview of services that are available in the community, signals that people should pay attention to tell them maybe you should look for some help, and also some kind of recommendations of what you could do in order to help you feel better. And on the other hand, the videos, this is based on a systematic meta review of the literature, where our team went through all these published meta-analyses to identify activities that could be done by individuals without supervision in their homes, and that have some kind of evidence of efficacy and safety. All right, so we did that review. It's published. It has received quite a bit of traction internationally, has been adopted by some organizations as a guidance. And so we used all this information and tried to put this into like short videos that talk about anxiety, depression, what people can do, primarily based around clinical programs like acceptance commitment therapy, cognitive behavioral therapy, but also some other intervention tools from psychology. So now, how do people in the community evaluate these resources? So, and for looking at the, like how people like this, we adapted some guidelines from the intervention design literature, where people make a distinction between, what kind of features need adaptation. Is it a kind of a surface or a deep feature? Is it a core feature of the program or a more peripheral feature? Or do we need to stay close to established effectiveness criteria, or focus on adapting to the local environment? So, in order to look at this, we used focus group discussions with individuals who work in the mental health um, field in general in the community, and we asked them, what do you think works, what did not work, what needs improvement in relation to both the leaflet and the videos. So first of all, the leaflets, generally very positive feedback. People were like, it's the right level, it's accessible. Some issues about its printed material, so literacy rates are an obvious issue, and obviously also lack of interactivity, and like not enough focus on demystifying mental health. The videos, on the other hand, also positive feedback in terms of its objective, clear, well-paced. People like the exercises and the metacognition. On the other hand, though, because it is health professionals talking about the evidence, it was seen as relatively cold, like having, a person who's obviously not from the community in very formal clothes talking a formal language was seen as kind of alienating. So it was seen as somewhat technical, reductionist, and also maybe a little bit individualistic compared to the very community focus that we would see in the Mare. So key points so far from the representative survey, very clearly what we need to do is we have to identify individuals that are vulnerable to be negatively affected by COVID or by challenges in general. Second of all, we need to look at the pattern as it evolves, so the analysis, the continuing analysis of the health challenges and also the vaccination effects. So the data collection is ongoing. We need we need to do further needs assessment and also a better understanding of the expectations of the community in relation to the resources that are available, and look at this through an intervention science perspective, specifically looking at cultural adaptation processes. So looking forward, really what we have to think about is scalable monitoring and intervention programs that can be rolled out across the population, but are responsive to the needs of the individuals. We have to look into this kind of mismatch between, like this demand for face-to-face interventions, because we know this is not going to be feasible with the available resources. Also, the expectation that, like actually quite costly digital media interventions, apps, videos, etc. Again, they are very costly to produce, might not be as effective as we have seen in the international literature. So there's stuff to be done in terms of managing expectations and looking at interventions that can be rolled out. So ultimately, like how can we balance costs and benefits? So just briefly, have to thank the amazing team, like the amazing team of research assistants that have been doing all the hard work, doing the interviews, doing the surveying work, and also the teams that were involved in producing all this material that helps people to feel better. So big thank you, big shout outs to those people. And also, really need to acknowledge all the sponsors of this work. So that's it for me. Thank you very much, and looking forward to a constructive and helpful discussion moving forward.